Breast self-exam. How does breast tissue change? Have you ever wondered why your breasts might feel different at certain times of the month? Understanding how breast tissue naturally changes can help you perform better self-exams and catch any unusual signs early. Breast tissue is quite dynamic and responds to hormonal shifts during your menstrual cycle. These changes are completely normal and involve fluctuations in size, texture, and tenderness. Hormones like estrogen and progesterone are the main drivers of these changes. Estrogen peaks just before ovulation around the middle of your cycle, causing the ducts in your breasts to enlarge. After ovulation, progesterone rises during the second half of your cycle, stimulating growth in the milk-producing lobules. This hormonal dance leads to your breasts feeling fuller, sometimes tender, and even lumpy, especially in the days before your period. During the first days of your cycle, from day 0 to 5, your breast tissue tends to be less active, with minimal swelling or cellular activity. Between days 6 and 15, the acini or small sacs in the lobules become more defined as they grow. As you approach the end of your cycle, from day 15 to 28, your breasts may feel noticeably fuller and more tender. This is due to increased glandular tissue and fluid retention, which can cause a dense or bumpy sensation. The ducts themselves stay relatively stable, so most of these changes are in the glandular tissue and surrounding stromal tissue. Many women notice physical symptoms like tenderness, swelling, or a cobblestone texture in their breasts, especially near the outer areas close to the armpits. These symptoms tend to peak just before your period and usually improve once your period starts. Because of these normal fluctuations, it's best to perform your breast self-exam at the same time each month, ideally a few days after your period ends when your breasts are less tender and swollen. This consistency helps you distinguish normal cyclical changes from any new or unusual lumps or skin changes that might need medical attention. Knowing how your breast tissue changes during your cycle is a vital part of early detection. It helps you avoid unnecessary worry over benign changes and focus on noticing any persistent or unusual signs. If you find a lump that feels different from your usual pattern, or if you notice nipple discharge, skin changes, or alterations in breast shape, it's important to consult a healthcare professional. Remember, breast self-exams are a tool to increase awareness, but they do not replace regular screenings like mammograms, especially if you have risk factors such as a family history of breast cancer or fibrocystic changes. In summary, your breast tissue naturally varies throughout your menstrual cycle due to hormonal influences. These changes affect how your breasts feel and look, and understanding them can help you perform more effective self-exams. Always listen to your body, perform regular checks at the right time, and seek medical advice for any concerns. Staying informed and vigilant is your best strategy for maintaining breast health and catching any potential issues early.